Hello. Steroids are medications prescribed for a number of health conditions, including breathing problems, swelling of your joints, and bowel inflammation. Steroids may be given for a few days, several months, or years, depending on the condition your doctor is treating. While steroids are great at reducing inflammation and pain, they can cause your blood sugar levels to soar, whether or not you have diabetes. For people who have diabetes, this is called steroid-induced hypoglycemia. In people who do not have diabetes, this is called steroid-induced diabetes. This may or may not go away when your steroids are stopped. Signs of steroid-induced diabetes may include needing to pass urine more often, feeling thirsty, having a dry mouth, blurred vision, tiredness or fatigue. Some people are more likely to develop high blood glucose levels, also known as hyperglycemia, when started on steroids. This is more likely to happen if you already have type 1 or type 2 diabetes, you are obese, you have a family history of diabetes, you have been diagnosed with pre-diabetes, or you have previously had high sugar levels whilst taking steroids. After taking tablet or liquid steroids, your sugar levels will rise 4 to 8 hours later. It happens more quickly if you're given steroids into your vein. Your blood sugar levels can be monitored with a finger prick test where a small spot of your blood is tested for sugar. People without a pre-existing diagnosis of diabetes. If you do not have diabetes, your blood sugar levels should be checked at least once daily, normally before lunch or dinner. If your sugar levels become high, you will need to be checked more frequently. If your levels remain high, you may need to start taking medication such as tablets for diabetes or insulin injections whilst you're taking steroids. Your GP will continue to check your sugar levels after you've completed a course of steroids. If your levels return to normal, it's likely you'll be able to stop the medication. People with a pre-existing diagnosis of diabetes. If you have diabetes, your blood sugar levels should be checked 4 times a day, before or after meals and before bedtime. If your levels are consistently high, you may need to be started on diabetic medication or insulin for diabetes, or have your current medication or insulin increased. If you have any questions about taking steroid medications or think your sugar levels are rising whilst taking steroids, please speak to your GP or the hospital doctor looking after you.